if the belief is that the problem is purely a biochemical problem in the brain, then why would anyone take any actions to change? I'm Dr. Matthew Klein. I'm the medical director and psychiatrist at First Step Center. And today we are talking about dual diagnosis. What dual diagnosis is pretty simple. It's when someone has both a mental illness and a substance use disorder. Doesn't matter which came first. The implications of dual diagnosis, though, can make things unclear. Often drug use without knowing drugs are being used will look like a lot of psychiatric diagnoses, and it can be almost impossible for an evaluator to tell the difference if they don't know the whole picture. And unfortunately with drug use, people often hide that part of the picture because there's often a valid concern that they'll be told to stop or intervention will be made. So often it's pretty common for someone to come in with a lot of past psychiatric diagnoses while they were using drugs but not fully disclosing, and those may not be the most accurate diagnoses because they may have been based on symptoms that were the effects of substances of abuse. And in those cases, that's when it is helpful to especially focus on the drug abuse first and reevaluate later. Some people come in, some people do have very well established psychiatric diagnoses. Some people have found successful treatments with those as well, and then also developed a drug problem for whatever reason. And in that situation, we typically would continue what was known to be successful while also working on the substance use problem. One of the problems in dual diagnosis also is if there's active substance use, almost all the other treatments are very ineffective or not effective at all. The drug use really kind of trumps everything. And some of that is because it's so powerful on the brain. There are not psychiatric medications that can honestly compete with the pain relief of opiates, or there are some psychiatric medicines that are highly abused, and in addiction those should be avoided if at all possible. But the therapy and all these other things, they typically take a processing of feelings and emotions and an emergence of emotions to be able to discuss them and process them. And when drugs are involved, that just doesn't happen. Typically it's a few weeks after being off drugs, people start to get their emotions going again. And that's sometimes distressing because it's not something that people who have using drugs may have not had to really learn how to process emotions, and it can be quite overwhelming to have potentially years and years of emotions and personal judgments about self and all that building up and then starting to come up again when the numbing or masking effect of the drugs is gone. But I guess the bottom line is, if the drug problem isn't addressed, there's not going to be progress in the other areas. One of the issues when there is a dual diagnosis picture is that the substance use, and then especially when it's severe, will really predominate. And it's seldom to rare, I would say, or rare to none, that someone gets well without addressing the substance use problem. So in an ideal situation, someone would get off of drugs and then stabilize and then reevaluate. A month or so later, it may take even longer to get a good reevaluation. Of course, there are cases where someone uses a drug to cope, and when they've found an alternative coping skill or mechanism or treatment, their perceived need to use the drug diminishes greatly.